So it's fourth day after surgery, and I was thinking about doing something a little bit different today because I feel like a lot of the videos have been these success things, which are good to remember. But I just wanted to share some of the hardships, and I don't want to sound like I'm complaining because I really am grateful for the progress I've made. But I just want to kind of put it out there to the internet and also myself to remind myself that it wasn't always lollipops and gumdrops. So the first thing that comes to my mind of the hardships the first couple of days is just sleep alone has been pretty rough. Seems like every time, and you hear this so much in rehab, with no matter what injury, surgery or an injury, when it's time to lay down and go to bed, things just start kind of just getting riled back up for some reason. And to me, it almost feels like restless leg. And then there's first couple nights is pain would go up, and you just get restless. You want to move, and it hurts, and you almost want to just do something with your leg, but it also hurts. So I'll get last night might have been a little bit better, but I'll get 2 hours of sleep, wake up for 30 minutes, 3 hours of sleep, wake up for 30 minutes, wake up, take a pain medication because I'm trying to stay on top of it. So just in general, sleep has been really, really difficult. The first couple days, I had all those muscle twitches or fasciculations where it's like that kind of, when your calf is spasming, but it was all in my quad that was all spasming. And then in general, just the fatigue of having to put the brace on, take it off and everything. It's really, and you're walking around constantly worrying about it's good. In terms of progress, I had a couple good workouts today, but nothing really, no huge breakthroughs like yesterday. A few more straight leg raises, but at the beginning, I started trying to do my straight leg raises this morning. I was like, okay, I got these last night, and I started to try to do them, and it's just nothing. Whether it be kind of increased inflammation because I've been pushing it, or just it wasn't warmed up, or whatever, but it wasn't like it was handed there, and the progress is little, if any, and I'm still having a tough time with knee flexion. Still feels pretty inflamed, so I've been trying to work on getting the inflammation down with ice and compression and whatnot. But I said I was going to do a video about walking, so here it is, 4 days of walking post-op. Even with the meniscus thing, he has me weight bearing, which again is kind of an uncommon thing. Usually meniscus stuff, you're not in weight bearing for a while. But ACLs, what it can look like, so standing up, and anytime you put the affected leg down, you just put the crutches together. All right, so I'm feeling pretty confident about moving. I don't know if the doc is wanting me to do it, so I'm kind of holding off on it, but I can do the single. I can do a little single crutch walking. Obviously feels a lot better with 2 crutches. And then the classic stairs, you go up with the good, right? So you're just going up with a good one. And then on the way down, crutches go first, right? Then you're going down with the bad. So this good leg is lowering you down. First time I did this, my girlfriend was like, "Why would you do it that way?" And you're like, "No, that's the way you're supposed to do it." When I first started walking, I had to really think about firing my quad to put weight through it and keeping it real tight the entire time. Now I'm not thinking about that as much, but I can tell when I do think about it, it definitely does help a little bit more. Anyhow, 4th day afterwards, little updates on everything. Tomorrow I'm going to try to kind of get a good workout with some crunches and maybe some push-ups. So we'll see how tomorrow goes.